Well, what's different about COVID is the body's immune response. That's what kills people. It's what gets so out of control. If you just have a pneumonia, we give you some antibiotics, you usually get better and you go home. When you've got COVID, you may get pneumonia in addition, and we have to treat that, but your body has this big inflammatory response. It gets it at about 2 weeks, and that's what causes your blood to clot, those weird clot problems that you get with it. It also can give you this thing called ARDS. Your lungs get thick and stiff, and it's hard for the oxygen to get through and get into your body. And it's crazy. I call it the self-destruct sequence. It's no good, but it's what's happening. And that's why it's so hard to treat, because we don't have the magic pill for the immune response. We try, but we haven't found the perfect cure. Well, with a bacterial infection, you give an antibiotic. You get specific to that infection, that particular organism, and treat it. With COVID, we try to go antiviral, but by the time the patients come in, they're usually been sick 2 weeks. You can hardly stop that viral problem now when they've had it 2 weeks. Then we try to treat their immune response. We try that with Decadron, Solumedrol, and things to calm down the immune response, but that immune system response is so strong, it is really hard to stop that and turn that around. And then we're also just giving supportive treatment, just giving high flow oxygen, trying to force enough oxygen into them to where they can keep perfused well enough. They don't like it very much. It's hard. They're just, the 2 weeks that they're really working and they're really sick, they're just focusing on breathing, and we're running high flow oxygen on them, just like these big noisy machines are blowing oxygen in their face. Sometimes we put them on BiPAP, which is more pressure. It's a mask over their face really tight, and blowing oxygen, and they just barely have time to take it off and even take a little sip of water. It's hard for them to hear what we're saying, hard for us to hear them. We try to get them to prone. We try to get them to lay on their belly and make their lung surface area expand it. We try to get them to lean forward, and it doesn't feel good. They're just focused on breathing, and the nurses we're just bossing them around, trying to make them do things that can help them pull through. So I would say they become exhausted. They have a hard time sleeping, and we're always working with them, trying to give them treatments and move them around.